Hi, I'm Mitchell.
And I'm Jackie.
I'm a clinical exercise physiologist from Exercise Healthcare Australia. And today we're going to take you through one of our assessment tools we use to assess range of motion.
What we're testing here is forward flexion or the hamstring length. So what I'm going to get Mitchell to do is feet together, knees together, keeping your legs straight, trying to bend down and touch your toes. Good, and then coming back up. What we're looking for here is, can he keep his legs straight? Can he shift his hips backwards and then coming up? And then can he touch his hands to the floor? If you can't do any of those things, we're going to go and test this test. What we're looking at now is hamstring flexibility. So how to perform the test. We're going to grab your client by the ankle, keeping their legs straight. We're going to keep the knee straight all the way up. Good, until they find a stretch where they can't go any further. Looking for 90 degrees. If they can't get to 90 degrees, we're going to perform these two exercises. So if they weren't able to achieve 90 degrees of hamstring length or hip flexion, what we're going to do is grab a band around the midfoot. Good. And Mitch is going to slowly use the band as leverage to stretch out his hamstring, making sure his back's pushed against the floor. Good. And we're going to hold this for 20 to 30 seconds, relax, and then repeat each side. So our more dynamic hamstring exercise is called the inchworm. To perform this exercise, Mitch is going to keep his knees straight, walk all the way out into a high plank position. Good. Walk all the way back. Very good. And we're going to repeat for 5 reps.
What we're going to assess here is extension of the system. So to perform this assessment, I'm going to get Jackie to stand there with her feet together, knees straight and her hands on her hip. What I'm going to do is I'm going to instruct Jackie to push her hips as far forward as she can. And what I'm looking for is, does her front of her hips pass the toes in this position? If we can't do that, then we're going to go and perform another assessment. So if they weren't able to push their hips past the toes, we're going to perform the Thomas test, which tests hip extension. To perform this test, we're going to get Jackie to sit on the edge of a bed or a box, grab one leg and fall back. Then in this position, we're assessing the opposite leg. So what we're looking for is a straight line from their femur through their body, and then their knee at a 90-degree angle, shin hanging down to the floor. If they don't achieve either of these, then we're going to perform these two exercises. So if they didn't have 90 degrees of knee flexion during the Thomas test, what we're going to do is perform the couch stretch. To perform this stretch, we're going to have their back foot on a wall or a chair or a couch, their front foot out in front of them in the lunge position, back knee on the ground. Then they're going to get their pelvis and tuck their hips, then hold a position of slight stretch in the front of their thigh for about 30 seconds. A dynamic option to improve hip extension range of motion is going to be a hip flexor to hamstring stretch. To perform this exercise, Jackie's going to tuck her pelvis and push her hips forward, stretch her hip flexor, then she's going to fall back, straighten her front leg and stretch her hamstring. She's going to roll through these for 4 to 6 repetitions.
The test now is his hip and thoracic rotation. To perform this test, feet together, knees together, hands across chest. We're going to rotate to the left through his hips and his shoulders, looking at 45 degrees through his pelvis, 45 degrees through his thoracic spine, or his shoulders towards his midline. If you can't achieve any of these, we're going to go and do these tests. So if they weren't able to perform 45 degrees of hip rotation, we're going to do internal rotation first. So we're going to do hand on the outside of the knee, hand on the inside of the ankle, and we're going to push the ankle out, looking at the femoral internal rotation, looking for 45 degrees here. If they can't achieve that, we're going to go and do this exercise. If they weren't able to achieve 45 degrees of internal rotation, we're going to do a dynamic hip 90-90. Perform the exercises 90 degrees at both hips, and then Mitch is going to slowly push both knees towards the ground. Very good. Alternating sides. Good. And we're going to go 5 repetitions each side, really trying to push our hip in towards the floor for internal rotation. What we're looking at now is external rotation of the femur. How to perform the test: inside of the thigh, outside of the ankle. We're trying to push the femur outside, looking for 45 degrees. If they can't achieve that, we're going to go and perform this exercise. If Mitch wasn't able to achieve 45 degrees of hip external rotation, we're going to do the pigeon stretch. Perform this exercise. Knee is going to be towards the ground, looking for a 90 degree or an L position, and he's going to push down, so his hips trying to push into the ground. Very good. And we're going to hold this for 20 to 30 seconds, and he's going to come out of position, repeat on the opposite side. What we're testing now is thoracic rotation. So to perform this test, we're going to get Mitch to put something between his legs so he doesn't get any pelvic rotation. Hand across chest, and we're going to get him to rotate towards his right. Very good. Looking for 45 degrees and relax. Good. If you can't achieve 45 degrees, you're going to go and perform this exercise. If you weren't able to achieve 45 degrees of thoracic rotation, we're going to do a half-kneeling thoracic rotation stretch. So inside leg on the ground, inside hand against the wall, outside hand is rotating around, trying to reach behind him. Very good. Trying to keep the hips nice and forward so we're not getting much rotation through the hips as well as through the spine. And you're going to go 5 times each side.
What we're going to assess here is shoulder range of motion. To perform this assessment, we're going to get Jackie to face the other way. Then we're going to instruct her to get her hand and reach over the back behind her head to touch her opposite shoulder blade. If she can't do this, then we're going to perform this assessment. So if they weren't able to reach over the back of their head and touch their opposite shoulder blade, we're going to perform this assessment. We're going to look at external rotation of the humerus. So to do this assessment, we're going to pin their shoulder blade down, grab their hand, and then we're going to rotate their arm backwards. What we're looking for here is 90 degrees, or their forearm parallel with their body. If they can't achieve this, we're going to perform this exercise. If they won't achieve 90 degrees of external rotation from the shoulder, we're going to do some shoulder dislocates. So you're going to grab a dowel or a stick, put their hands as wide as possible, keeping your elbow straight. You're going to lift the dowel over and around their back. Then as they get more confident with this, with their time, they can bring their hands in closer. We're going to perform 10 to 12 repetitions. The next shoulder assessment we're going to look at is we're going to see if Jackie can bring her hand behind her back and touch her shoulder blade from underneath. If she can't perform this, then we're going to perform this assessment. So if they weren't able to reach behind their back and touch their opposite shoulder blade, we're going to test shoulder internal rotation. To perform this test, we're going to grab their shoulder and pin it to the bed. Then we're going to grab their arm and rotate it forward. What we want to see is 70 degrees here. If they can't do this, then we're going to perform this exercise. So if they weren't able to achieve 70 degrees of internal rotation of the shoulder, what we're going to do is a sleeper stretch. To perform this stretch, you're going to lie on your side and you're going to use your inside hand to stretch your outside hand. So holding that position, you're going to push down until you feel a slight stretch in the front of your shoulder. You're going to hold that for about 30 seconds. Thanks for watching. I really hope you found this useful. If you do have anyone who experiences serious pain or discomfort with any of their tests or any of the exercises, we encourage you not to continue with these and refer on to someone who can help.